Welcome to Public Health on Call, a podcast from the Johns Hopkins Bloomberg School of Public Health, where we bring evidence, experience, and perspective to make sense of today's leading health challenges. If you have questions or ideas for us, please send an email to publichealthquestion@jhu.edu. That's publichealthquestion@jhu.edu for future podcast episodes.
Hey listeners, it's Lindsay Smith Rogers. Today, baby bonds. Catherine Ettman, an assistant professor in the Department of Health Policy and Management at the Johns Hopkins Bloomberg School of Public Health, talks with me about these wealth-building policies, explaining how they work, what we know about the benefits and impacts, how Trump accounts fit into this whole landscape, and why we could soon be seeing more and more states enacting these policies. Let's listen. Catherine Ettman, thank you so much for joining us on Public Health on Call. Would you tell us a little bit about you and your work?
Thank you for having me. My name is Catherine Ettman, and I am an assistant professor in the Department of Health Policy and Management at the Johns Hopkins Bloomberg School of Public Health. I study population mental health, assets, and policies across sectors that can improve assets, which can improve health. And in my work, we explore policies that help people to earn money, keep money, and grow money. And we'll talk about that today and how it relates to people's health.
Yeah, so specifically, we're going to be talking about baby bonds. So tell us, what are baby bonds? How do they work?
Baby bonds are publicly funded trust accounts that are established for children at birth in low-income families. And the goal is to build long-term wealth and to reduce the wealth gap. So governments can invest a seed amount for eligible children, which will grow into adulthood. And once children come of age, typically between 18 and 30, they can use these trust accounts for wealth-building purposes, such as home ownership, education, building a business, or even investing in their retirement.
And so give us like a real-world example of where this is happening.
Connecticut is the first state in the country that has a statewide, state-funded baby bonds program. So in the state of Connecticut, every child who's born with a mother who is covered with Medicaid insurance receives $3,200 at birth that is put into a trust fund that is managed by the state treasury. And over time, that $3,200 is expected to grow. It can grow upwards of $20,000 or even up to $30,000 by the time they're 18 to 30 years old. And once they come of age, those children can then use those funds to invest in education, home ownership, building a business, or their retirement. And now there are other states who are interested in piloting programs ranging from Missouri to New Mexico to Georgia. And those are just a few examples of where there is interest and excitement in this policy.
So in that specific example, how were those baby bonds funded?
In the case of Connecticut, this is publicly funded. So this is funded through reserve that was in the state treasury. So Connecticut had excess reserves that were being served for another purpose, and they were not needed anymore. So they were able to reallocate those funds to establish a trust fund for baby bonds for children who are born into low-income families, such that 18 years from now, these children can now invest in their economic future and invest back in Connecticut.
And so how are baby bonds different from, say, like guaranteed income or cash or something that parents might get when babies are born?
I think their goal is different. So universal basic income or cash transfers, they address immediate needs in real time, whereas baby bonds build an asset for the future. Now, both are needed and important. I mentioned earlier that our work looks at policies that help people to earn money, keep money, and grow money. And cash transfers can help people to have that improved cash flow in terms of what's coming into a household, but it doesn't necessarily help people to grow their wealth. Baby bonds are intended to grow wealth. So they're meant to grow over time so that children who become adults can make large investments in their future. And in this way, baby bonds are a wealth-building tool, whereas cash transfers are more to address real-time immediate needs.
And so tell us a little bit about what you know of the impacts of baby bonds.
What we know about baby bonds comes from the previous literature. So we know that wealth and health are linked. People that have greater wealth live longer lives, have healthier lives, better mental health. And when we think about baby bonds in particular, we look to three different types of research. So we look at natural experiments, randomized control trials, and simulations. So first, we can look at natural experiments. So that's when there's a naturally occurring policy that happened in real life that we can glean information from. And one of the best ones we have is the Great Smoky Mountains study, whereby a group of children had access to financial infusions throughout their lives. Now, this is a natural experiment. This happened because there was a casino opening, and children who were tribal members, got access to these cash infusions, whereas other children who lived in the similar area but did not have that membership did not receive these cash infusions. So in this way, we have a natural treatment group receiving these cash infusions, and then a natural control group who didn't. And over time, studies have been able to track the health outcomes and other economic outcomes of this cohort. And they've been able to follow this group up to age 30. And what they found is that those children who received these financial assets had better mental health, physical health, and better financial behaviors, financial function into adulthood. So that's one example of a natural experiment whereby having access to these wealth infusions, because the children, they got on average $5,000 per year, but they couldn't access them until they were 18 or over. We found that those children had better outcomes as a literature. Second, we can use randomized control trials. So this is where people run experiments where they take a group of low-income families and randomize one group to receive $1,000. So this was the case of the Oklahoma seed experiment, whereby low-income families were given $1,000 in the treatment group. And what they found was, even though the parents could not access those funds, they were intended for the children, we saw improved mental health in mothers over time. So this suggests, again, that this wealth building is fulfilling something different than just a cash transfer. And by we, I mean standing on the shoulders of giants here. This is the literature. This is not our work directly. We'll talk about our work in a moment. This is work by Dr. Sheridan and others. So that's the second type. And then third, we do simulation modeling. So we use the best available data in order to estimate the effects of baby bonds into the future. And these all together suggest that indeed having more assets, and importantly, having wealth, improves health and other outcomes later in life.
And so people may have heard of Trump accounts. Can you talk a little bit about what those are?
Yes. So Trump accounts were established by the Budget Reconciliation Act of 2025, whereby eligible babies born between 2025 and 2028 will receive a government-funded $1,000 seed investment, and that is anticipated to grow over time. So there are similarities and differences with baby bonds. One similarity is that we are investing in children and showing that there is wealth accumulation. There are benefits to having this early life wealth generation. Now, a difference is that Trump accounts are for all eligible children, whereas baby bonds are targeted. And the intention of baby bonds is really to close wealth gaps. So baby bonds are automatic for families who have low income. They're targeted such that they can be generous and create real generational wealth for people from low income backgrounds.
And Trump accounts, when you say that they are for eligible babies, who is eligible?
So these details are still being sorted out by the Treasury Department, but typically the child would need to be a citizen.
How do parents sign up for that?
Parents can sign up for it in two ways. They can either check a box on their tax returns, which we encourage parents to do if they are eligible, and also they can sign up on the government website. So Trump accounts are available to all babies with citizenship in this time period. But because families from lower income backgrounds might have more challenges to accessing benefits or may not even file tax forms, we really want to ensure that there is public awareness about this benefit such that those from lower resource backgrounds can also take advantage of this $1,000 investment.
And so you mentioned that you have done some research in this area. Why don't you tell us about that?
Yes. So we led a national study where we polled a representative group of U.S. adults, 18 and over, and we asked them, do you support the idea of early wealth investments for children from low-income backgrounds? And we used the Connecticut example to define this for participants to say, children might receive around $3,000 at birth. It'll grow anywhere between $20,000 to $30,000 into adulthood, and they have to use it for wealth building, buying a home, education, starting a business, or retirement. Do you support this policy? And we found that Americans overwhelmingly support this policy. 67.6% of U.S. adults support a baby bonds-like policy that would create a meaningful wealth investment, particularly for children born into low-income families. We found that there was high levels of support and that these levels of support, they did differ across some demographic characteristics, which is important for us to know which areas could use further investment in terms of understanding values and where certain populations are so that we can meet them where we are to understand what can close that gap in terms of support for a policy like this.
So it sounds like they're popular. We know that they work. I would imagine one of the big limitations here is just getting that funding. But, do you foresee more states rolling out baby bond programs?
Absolutely. I think there is a lot of national excitement right now for this idea of early wealth building. So baby bonds are funded through a mix of state funds, public funds, general funds, and also philanthropy. So with growing support and growing interest across states, I think that there will be more resources, more excitement that will be committed to this program. And we're seeing pilots across red and blue states. Some programs are investing in children, like in Connecticut. So in 18 years, we'll get to see the fruits of these labors, where we have 17,000 babies who are already eligible and have baby bonds. But there are other states that are doing catch-up contributions. So they are giving, again, meaningful wealth. This is upwards of $20,000 to teenagers. And they're telling them at age 15 to say, when you turn 18, from 18 to 30, you will have access to this wealth vehicle. So states like Colorado, Georgia, Missouri, these are all states that are hosting these pilots right now. So there is absolutely excitement across the country, across political lines for the potential for these policies. And I should note that the people who are involved in these pilots are giving us really helpful information. So many of the pilots require some type of a financial coaching as part of receiving this benefit, which others have heard, our colleagues at the Urban Institute have heard that is something that's really requested by the participants. They say, we want to know how to invest our money well and how to do right by this meaningful wealth that we are about to receive.
Well, this is really exciting. And thank you for breaking this all down for us. Catherine Ettman, thanks for joining us.
Thank you for having me.
Public Health on Call is a podcast from the Johns Hopkins Bloomberg School of Public Health, produced by Joshua Sharfstein, Lindsay Smith Rogers, Stephanie Desmond, and Rachel Walsh. Audio production by Michael Bonfils, Matthew Martin, and Philip Porter, with support from J.B. Arbogast, Spencer Greer, and Chip Hickey. Distribution and social media by Rachel Walsh, with support from Nick Moran and Brianna Iacovelli. Follow us on Instagram and Blue Sky at Public Health Pod for more public health takes and special content. If you have questions or ideas for us, please send an email to publichealthquestion@jhu.edu. That's publichealthquestion@jhu.edu for future podcast episodes. Thank you for listening.